Hi, I'm Velvet Tupper. I am a nurse continence advisor with the Regional Continence Program at Trillium Health Partners. Today, I would like to share some information with you on bowel management tips for personal care attendants. We are going to cover what you can do to help your patient or client and when to refer for further assistance. First, we're going to talk about why bowel management is so important. So as you know, our body needs to eliminate waste and toxins on a regular basis or it affects our health. If a person has a poor bowel function, this can be indicative of other health issues. It is a normal body function to have bowel movements on a regular basis, and so it's really important that we monitor this in our patient and clients. So there's 3 questions you can ask yourself. And we're going to go into each question in detail. So first, we'll just review what the questions are. Question number 1 is, did your patient or client have a bowel movement today? Question number 2, do they have control of their bowels, either with an ostomy or with a bowel routine where they're up and toileting? And if they're using laxatives, if it is implemented, if this is working. Question number 3 is, what is the size of the bowel movement, the consistency, and the color? And we'll talk about why this is important. So question number 1, did your patient have a bowel movement today? It's basically yes or no. It's normal for most people to have a bowel movement from 3 times a week up to 3 times a day. So you need to ask lots of questions. So you're looking at the person's pattern now, but you want to ask them, is this your regular pattern or has it changed recently? What is your normal pattern been like for the past few years? So sometimes people will have a normal bowel pattern, but it doesn't fit in this range of 3 times a week to 3 times a day. So if you're talking to the person and you find out their normal has been a bowel movement twice a week, and the stool is not difficult to pass, it's soft formed, then that can be that person's normal. So we don't have to fit strictly in that criteria of 3 times a week to 3 times a day. This is a guideline, so some people may not fit that. And it's also important to note, if they've had no bowel movement in 2 days, that let the family or caregiver or nurse know so they can investigate further to see what the issue is that is contributing to them not having a bowel movement. So question number 2, did they have control of the bowels? So this can be with an ostomy. If there's stool moving into the ostomy, then the bowel is working. Or if they're on what we call a bowel routine, where they're maybe taking laxatives every day, or they're going and sitting on the toilet, like on a schedule, like say every day after breakfast. If these are some of the things implemented, what has happened? Were they continent? Did they get to the toilet in time? Or were they incontinent, meaning they had an accident in their underwear or their incontinence brief? Or some people can have it both ways. So sometimes they can be continent and sometimes they have no control. And the third option is they've had no bowel movement. So you want to look and see, did the person get to the toilet in time or were they having an accident on the way to the toilet? Are the laxatives they're taking effective in promoting a bowel movement? Sometimes a person can be taking laxatives and can have no results. So maybe they're not having enough laxatives, or they maybe need to change the type of laxative. If the person has an ostomy, and it should be having stool in it regularly, and it should be needed to be emptied every day. And you want to ask them, when was your last bowel movement? And if they don't have a good memory, you may have to rely on family, but you want to always ask them, did your bowels move today? If they say no, then investigate further and find out, did they have a bowel movement yesterday or the day before? So question number 3 is, did your patient have a bowel movement today? And they had a bowel movement. So you want to look at What did they pass? Did they have a small, a medium, or a large amount of stool? What was the texture like? Was it soft or hard or in between? Did they tell you what they had a hard time to pass that stool? They had to really bear it down. Were they grunting? So we have all this information, but what does it mean? So we refer to something called the Bristol Stool Scale. This is a chart that we use all over the world to describe bowel movements. So it makes it really easy for you, yourself, or for your patient to just point to a picture, and it gives you that full description in just a picture. So you want to know what it looks like. You also want to look at the color of the stool. Stool is always brown if it's a normal stool. It may vary, in shades, but if there's other colors in the stool, you have to look at the diet. So sometimes you'll see flecks of red, could be from eating red peppers or tomatoes. If it's got a green tinge to it, it could be they ate some spinach. Or if it's sort of red or purpley red, and it could be from eating beets. So what is a normal poop? So we talked about what is a normal pattern, which varies from 3 times a week to 3 times a day. So this is when we're going to use our chart to determine if that person's having a normal stool. So these are charts that are easily found on the internet. If you just chart in or type in stool chart, all different types come up. Some are kind of funny and entertaining. Some use words to describe them. Some use pictures. So they can vary. And what I use is the standard one. This is the Bristol Stool Scale. This is used in Canada, the States, the UK, and Australia. And it's very, very simple. You have 7 types. Each type is different. So when you show this chart to your patient or client, it's very easy for them to look at it and go, yep, I had a type 3 or I had a type 1. So we've determined what the stool looks like. So now what do we do with this information? So let's go into detail to look at the different types to see what they mean. So we're going to start with in the middle of the chart here, type 3 and 4. So these are what we call normal stools. So we often describe them as passing a hot dog or a snake or a banana, and there's no straining to pass. So we pretty much say this is a perfect poop. So type 3 is like a sausage, but you can see some cracks on the surface. Type 4 is very smooth and looks like the shape of a banana. And the person will tell you they did not strain to pass the stool. So this is our perfect bowel movement. So type 1 or 2 of the Bristol Stool Scale, if you remember from the pictures, they're like hard little balls or balls clumped together. People might describe them as passing peas or nuts. So this indicates that the person has a low fiber diet, and also they may not be drinking enough fluids. So if you look at the person, if they have dry lips and they're licking their lips a lot, have a look at their tongue. Sometimes the tongue can be kind of reddish. It looks a little what we call meaty or fleshy. So that is also indicative of not having enough fluids. And also be aware that many medications people take, especially as we get older or we have health problems, that many medications have the side effect of constipation. So the person could be eating good fiber and drinking well, and they're still constipated. So it may be due to medication. So what do you do to correct that? Well, we always say add more fluids, good fluids, not caffeine, and add water-rich foods such as fruit, vegetables, and whole grains because they have a lot high water content and they will help promote the bowel movement. And also, if the person has a really good diet and they are on these medications that are constipating, they may need to have a laxative on a routine or a schedule to keep them regular. So types 5, 6, or 7 of the Bristol Stool Scale, This is like the softer, looser stool. Type 7 is like a watery diarrhea. So these can be indicative of a poor diet. So if the person eats a lot of processed foods, or they may have, say, sensitivities to dairy, like milk or cheese, or they just have a low fiber intake, that can affect the consistency of the stool. Also, people can have poor stools that are soft and loose if they're not drinking enough fluids, because our body needs fluids to digest and process and to form stool. And again, medications may be causing the loose stools, such as antibiotics. Sometimes in diabetics, we have medications like metformin, which is an oral pill for diabetes to control sugar, and it often affects a person's bowels. The other thing that affects people a lot is stress. So stress can do two things. It can either contribute to constipation or it can cause diarrhea. So for some people, if they get really stressed out, they get really uptight. And then what happens is your whole body tenses up with stress. But the part that tightens up the most is your core muscle function, which is around your abdomen and bowels. So that can contribute to constipation because everything is so tight, they can't relax. Or in other people, stress causes them to have diarrhea. So it's important to ask a person, how their mood is. Do they notice a change in bowels if they become upset or stressed? And also, if a person is taking laxatives on a regular basis, they may be taking too much and they might be having really loose stools. So that's important to know, because that amount of medication should and can be adjusted down a little bit, so they still have the laxative, but it's contributing more to a formed stool and not a loose stool. So you also want to look for nonverbal cues in the person, especially for elderly people or people who are starting to have some cognitive impairment, Alzheimer's or dementia. Straining is often the first sign or symptom that we see in the older person that tells us they may be constipated. It can occur in up to 65% of community-based individuals that are over 65, and hard stools are reported in over 40% of the older population. So that's quite high. And they may have, it may be a chronic problem where, they may say to you, oh, this is my normal, I'm always straining. Or they might say, this is a new problem. All of a sudden my bowels don't move anymore. And they might have increased abdominal pain. Maybe they have some bloating or cramping. Sometimes they pass more gas. They might have loss of appetite or a headache. So, these other symptoms can be related to just being constipated. And if you correct the constipation, these symptoms can go away. Now, there's also non-specific symptoms, especially in people with cognitive impairment. So some people become really agitated towards the end of the day, and we loosely call it sundowning. And so we use this term for people who have cognitive impairment. And what happens is, with the change in the light, it's becoming evening, they become more agitated. And what happens is, if that person's constipated, it can make agitation worse. It actually can contribute to sundowning. And it also might affect the person's appetite. They may not want to eat, and they just feel unwell, and they just have like an overall decline in their function. So if you correct the constipation, often you can help that person feel more comfortable and settled, and they will sleep better. So how do we monitor the bowel function in a person? So we use a bowel record, or what we call a bowel diary. And what this is, it's a record of what the person eats and drinks on a daily basis. And you want to record everything they have and at what time. And you want to also record when they have a bowel movement and what the bowel movement looks like. And you can refer to the Bristol Stool Scale to document what that looks like. So here's an example of a bowel record. This is for 1 week. So it goes through Monday to Sunday. And you can see it's recording breakfast, lunch, and dinner, and any snacks they have. So please include the time and what they ate, and if it was a a full amount of food, or if they only ate half a portion. And did they have any symptoms? Did they have stomach ache, cramping? When they have their bowel movement, you can actually refer to the Bristol Stool Scale under bowel movements. You can write the time they had it. You can say if it was a type 1, 2, 3, 4, 5, 6, or 7. If you notice some mucus or blood, you might want to write that down. And any other notes that you think might be important to know, like was the person exercising after meals and up and walking, or did they have any stressful events, or did they sleep a lot that day? So this is a really good record. You can do it for a week, or you can copy it and do it for several weeks. So depending on the issue with the person, usually a week will give you a good idea of what their sort of regular diet is like and what they drink. Sometimes they do have a person record for 2 or 3 weeks if we're sort of looking for patterns, but it's a very effective tool. Okay, so what can the personal assistant do to help with the patient or client? So you can always encourage them to eat higher fiber foods, vegetables and fruits, such as pears and prunes we find very effective, especially in the morning at breakfast. And if they're eating lots of white grain or white breads, they'd be better off to switch to a multi-grain bread because of the fiber content, and it's better for absorbing water and stuff. Also, have that person drink more fluids. If you find they're resistant, they don't like to drink water, then we can encourage them to drink things such as, you can take an orange juice and make it half with water. So it's diluted, so they're not drinking a lot of sugar, but they're still getting that fluid intake. Also, caffeine in the morning is a very good stimulant for the bowels. Many times I hear people say, oh, I had a cup of coffee and that's what gets my bowels moving for the day. So it's fine to have coffee in the morning, tea or coffee for breakfast, but we don't recommend having caffeine later in the day. So if a person is someone who likes to have tea or coffee with every meal, we would recommend they have their regular drink in the morning and maybe try decaffeinated tea and coffee for lunch and dinner, or in the evening if they tend to have a drink then. Also, routine toileting 20 to 30 minutes after each meal. So the meal we eat helps to stimulate digestion. We digest our food from our stomach, goes down into our small intestine, then our bowels. And when it gets down to our bowels, that's when we tend to feel like we have maybe a sign or some, not cramping, but just some motion in our belly, thinking we might want to have a bowel movement. So usually that's about a half hour after a meal. So that's a really good time to have your patient or client sit on the toilet for a few minutes. And I tell them to sit whether they feel like they want to pass their bowels or not. And we just call this routine toileting, and that actually helps promote a bowel movement. So I always compare this to when you're having children and you have a young babe and you're trying to toilet that child when they're a few years old. So, we eat and we tend to put them on the toilet after they eat. And, we try to encourage them to go, and sometimes reward them with a cookie. So we can do the same with the older adult. Encourage them to do a routine toileting, and just tell them, you just sit for a few minutes and then get up. And what happens over time is the bowels will actually start to move after that meal. Also, promoting regular exercise, such as walking. And if the person can't get outside to walk, they can walk in the halls. So if they live in a condo, there's usually nice long halls. And if they use a walker, they can go out with their walker and walk up and down in the hall. Or if they're in a house and they're not able to go outside because of stairs, there's no reason why they can't walk around in the house, as long as there's a nice clear pathway in the house for them to ambulate. If the person is basically chair or wheelchair bound, they can do exercises in the chair, because any sort of arm or movement or leg lifting and stuff will also help to work the abdominal muscles to keep those muscles working and help to promote a bowel movement. Also, as a PCA, you're part of the team. So, you work with the patient, you work with the family, you work with, the professional caregivers, if there's a nurse or a doctor. So please, tell any of them if there's a change in their bowel pattern. If you do charting, you can always document it, what you observed, and let them know. So, when to notify family or the nurse? So, if the person has not had a bowel movement in 2 or 3 days, you should notify them. If the person is having a bowel movement, but they're very small, hard stools, like type 1 or 2, tell the family. And if they're straining, you notice they're really grunting or bending over and pushing, you want to be careful they don't, do damage to themselves, or some people strain so hard they actually can hurt themselves. So you want to be careful of that. Or if the person is having loose stools, you need to report that as well. And just as a side note, sometimes when you're assisting someone with care and you're doing, say, a bath or changing their underwear or brief, you might see some stool smearing in their underwear. So that is not considered to be a bowel movement. So that's why it's really important for you to find out if their bowels have been moving or not, because it could be they didn't clean themselves well enough. But if that's not the issue, it could be the person is severely constipated with stool, and we call that impaction. And so what happens is the person's full of stool down in the rectum, but it can't come out. So they sometimes will ooze a bit of stool and it might smear in the underwear. So that's something to be really aware of, because then they probably need a good laxative. So constipation can really cause some serious illness in people. And, maybe for yourself, even you've experienced it, so you know how uncomfortable it can be. So it's really important to monitor this, especially for the older adults and people who are starting to have cognitive impairment, because they can't always tell you how they're feeling or what their symptoms are. So, by you asking questions or just making really good observations can be very helpful. And then you can involve family or the care team to help correct the problem, and it keeps that person comfortable. So, what you do matters. Thank you so much for attending.